peace must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us. Our world faces a common enemy, COVID-19. The virus does not care about nationality or ethnicity, faction or face. It attacks all relentlessly. Meanwhile, armed conflict rages on around the world. The most vulnerable, women and children, people with disabilities, the marginalized and displaced, pay the highest price. They are also at the highest risk of suffering devastating losses from COVID-19. Let's not forget that in war-ravaged countries, health systems have collapsed. Health professionals, already few in number, have often been targeted. Refugees and others displaced by violent conflict are doubly vulnerable. The fury of the virus illustrates the folly of war. That is why today I am calling for an immediate global ceasefire in all corners of the world. It is time to put armed conflict on lockdown and focus together on the true fight of our lives. To warring parties, I say, pull back from hostilities, put aside mistrust and animosity, silence the guns, stop the artillery, end the airstrikes. This is crucial to help create corridors for life-saving aid, to open precious windows for diplomacy, to bring hope to places among the most vulnerable to COVID-19. Let us take inspiration from coalitions and dialogue slowly taking shape among rival parties in some parts to enable joint approaches to COVID-19. But we need much more. End the sickness of war and fight the disease that is ravaging our world. It starts by stopping the fighting everywhere, now. That is what our human family needs, now more than ever.
Thank you very much, Secretary General. We're now going to take some questions from the press. James Bays from Al Jazeera is asking, your call for a global ceasefire is obviously going to be difficult to achieve. I would like to ask you to address just one conflict as an example, Libya, where all parties are already supposed to be observing a humanitarian pause. But in fact, it seems one side, led by General Haftar, has used this period to intensify his military campaign.
There was a truce that was more recently decided again. It is not holding very well. And this is one of the reasons why I believe we need a global ceasefire. And all my special representatives will be very active, talking with the parties and trying to create a global dynamics in order for all countries around the world to put pressure on the parties to the conflicts everywhere to stop the fighting. I believe that this is the only way to address those situations where the parties have been quite stubborn in not accepting the need to a ceasefire, when everybody knows that there is no military solution and the fighting going on only increases suffering and makes the response to COVID-19 now even more difficult.
Just quick follow-up to that from Maria from TASS. You did mention that you were in touch with your special envoys. Have you received any commitments to the ceasefire from different sides in Syria, Libya, Yemen, Ukraine, etc.?
I'm launching the global appeal now. My special envoys will be now working with the parties to the conflict to try to make sure that this global appeal is not only listened to, but leads to concrete action, leads to a pause in fighting, creating the conditions for the response to COVID-19 to be much more effective. And let's not forget, those areas that are ravaged by the conflict are areas where the capacity of response is very limited. And if the fighting goes on, we might have an absolutely devastating spreading of the epidemic.
Yeah, and so Jessica from France 24 is asking a related question. Can you explain how you would protect the world's most vulnerable from the virus, refugees in particular?
Well, the UNHCR and IOM have been working hard to have a plan, working with the host countries in order to create conditions in refugee camps and or in settlements where refugees are, together with internally displaced people, both to prevent the arrival of the virus to those places through different measures, but also to create the capacity to respond and to mitigate the impact inside those camps. I appeal for the international community to fully support those measures. They will be included in a humanitarian appeal that we will launch on Wednesday, asking for $2 billion to allow us to have a humanitarian response more effective in relation to those dramatic situations where COVID-19 has needs by itself, but at the same time is linked to a desperate situation already in the countries affected.
Betul Yurik from Anadolu Agency is asking, do you think the measures taken by the world leaders are enough? And if not, what other steps would you like them to take?
I've just sent a letter to the leaders of the G20. I think it is clear that we need a much stronger coordination. Coordination in suppression of the disease, coordination in making sure that not only the developed countries can respond effectively to the disease, but that there is massive support to the developing world, not to let the disease spread like wildfire in the developed world. And then a huge package, a package to respond to the economic and social consequences, but not as in 2008, a package essentially aiming at the financial center. Now it's a human crisis, so the package needs to make households be afloat, make businesses be afloat, keep societies being afloat in this very difficult circumstance. And this will require a double-digit of GDP support in the developed world, and creating the conditions through the IMF, through the swaps among central banks, through the creation of new facilities. We need to mobilize enough funds to allow the developing countries themselves to be able to have an adequate economic and social response to the crisis. And then they need to make sure that when we recover in a more sustainable and a more inclusive economy.
Great. Pam Falk from CBS News is asking, are you concerned that this crisis is diverting attention from some of the world's other problems?
It is true. The crisis is diverting attention from many other issues. We need to be able to respond to the crisis, but at the same time, as I did today, to make sure that responding to the crisis, we are also addressing some of our major concerns. When I ask for a global ceasefire, the global ceasefire is, of course, absolutely essential for an effective response to the crisis in areas of conflict, but is also a value in itself. War doesn't make any sense when you have an epidemic, but war doesn't make any sense in any circumstances.
Okay, just two last questions. A number of journalists who are online are asking what world leaders you've spoken to.
I've been sending today a message to all G20 leaders. I've been speaking to several of them, and I intend to be in a virtual conference with all of them this week.
Okay, and the final question, how are you feeling, Mr. Secretary General?
I'm feeling strongly determined. This is the moment in which the UN must be active. The UN must fully assume its responsibilities, first doing what we have to do, our peacekeeping operations, our humanitarian agencies, our support to the different bodies of the international community, the Security Council, the General Assembly. But at the same time, this is a moment in which the UN must be able to address the peoples of the world and appeal for a massive mobilization and for a massive pressure on governments to make sure that
A very good morning to you, and thank you so much for joining us. Earlier on, we had Dr. David Matanga with the morning show there, and that was really nice. And so right now, good morning, and he shall be joining us on the top of the hour for Diplomatic Leaks. But right now, I'd like for us to just go through what is making headlines across Kenya, even as we look at the situation later on in Africa and other countries, and indeed worldwide, of this COVID-19. Thank you so much, and I hope wherever you are tuned in today, you are safe, and good afternoon, good evening, depending on where you're watching us from the world. Thank you so much, Johnson Hemmings, Thomas Moraura, all of you. Keep writing, and let me know where you're watching us from this morning here, just about 10 minutes past 11 a.m. here in Nairobi, East African time. So let's just get into it, and we start with the Daily Nation. Of course, Dr. Matanga, when he was on the daybreak, the daytime express early in the morning, over an hour ago, he looked at some of the headlines. So I'll just look at it and then perhaps read a few of the news making headlines here in Kenya, and then after that we shall look at some other information and the topic of the day this morning. So yes, the updates and all of that, and the latest, of course, figures in Africa and indeed across the world. We've seen a rise in numbers in some of these cases here, and so I don't know if it should be a cause of concern for all of us, but we shall see how that will pan out, and we shall read the latest figures as we have received them. And so we start with the Daily Nation, and on the front pages of the Daily Nation this morning, of course, we see a simple priest bows out. And yesterday we talked about the passing away of the Archbishop, a former Archbishop of the Catholic Church, and the curtains fall on one of the most prominent figures in the Catholic Church, 100-year history in Kenya, who despite his light frame was outspoken, fearless, and pulled no punches in the face of justice. And that story is on page 2 of the Daily Nation newspaper, and that Archbishop is none other than Archbishop Ndingi Mwananzeki, who was born in 1931 and passed on yesterday. And also on the front pages there, we see virus, keep your distance to stay safe. And so a World Health Organization warning to health workers that proximity could lead to transmission through the air in some environments has led to curiosity among researchers that the virus could be airborne, making social distancing and wearing of masks critical measures to keep safe. So some news came yesterday about a nurse who I said to have contracted the virus at a certain government hospital there. Imagine a nurse who has been treating people. We don't know how long she has had this, and we don't know how many patients she has had to take care of. And so you can imagine, so when CS for Health, Mr. Mutahi Kagwe, the other day came out and said, now we don't have to worry about importing the COVID-19 because the virus is here with us, and now it is going to be spread from community to community, from a person to a person. This is what he meant, because imagine this was a nurse. This is a nurse who was treating people, was on the working and in the general, ward there, taking care of patients and all of that. And so she contracted this disease. She was not wearing any protective anything, so she was just taking care of the patients as usual, which I don't really understand. By now, even the healthcare providers, I know we might not have all of these things in our hospitals and in our health clinics, in any medical institutions right now. Perhaps they're not all available, but I think we cannot keep taking such risks. Even them, they stand a greater chance of contracting the COVID-19. And so by now, I would think that anybody who is out there in the public service will be protecting themselves against this illness, but as it appears, the nurse contracted it. So you can imagine how many people she's had to take care of and how many people she's had to come into contact with. Maybe she uses public means to go to work and go back home. How many people came into contact with her? She has neighbors, perhaps she has a family. I mean, so the numbers should be worrying. And now you see the model that the Ministry of Health presented 2 days ago about if Kenya Kenya is not very careful, by the end of April, we shall have about 10,000 cases. If you look at it from this perspective, then these numbers could not be very far-fetched if Kenyans do not become very careful in the manner in which we social distance and how we even take care of ourselves and ensure that even when we go to public places, the doctor that is going to take care of you, the nurse that is going to take care of you, are they covered? Are you covered? Are you protected? So we have to look out for that. So the front page is there. And now, as I've read there, the World Health Organization are saying, the COVID-19 probably could be an airborne disease there. And so this has raised a lot of curiosity among the researchers. And also, a curfew did this boy have to die, the 13-year-old boy who was, shot in Kiamaiko slums there in Nairobi and was buried yesterday. A very unfortunate incident there that is happening, but the police has taken over the investigations, and soon we shall know what really happened there. That boy apparently was shot. He was in their house balcony, so I don't know if there are words to explain that. Very unfortunate, unnecessary death, but let's just see. The investigations have started, and let's see what the authorities will come up with. We move on to the Standard newspaper this morning, and taking time bomb as health workers catch coronavirus at the same cases I was talking about. Now, according to the Ministry of Health, there are 59 infected people, and government is well prepared to the surge. Yes, that was the latest from yesterday when they came out and they gave the new figures. Yesterday in the morning, we were at 50, also 9 more people, and among them is a health worker. So perhaps I'll just get into this so that we get a better understanding on what the Star about this story on page 4 and 5 of the Star newspaper. I'll just read a bit of it as we able to get a better understanding of what is really happening. Now, a clinical officer in Nairobi has become Kenya's first health worker to contract coronavirus in the line of duty. She was taken ill last week at Ngara Health Center in Nairobi, where she works. Now, her husband has also been confirmed positive. Both are admitted and isolated at the Kenyatta National Hospital IDU at Mbagathi. Now, their children and house help has been evacuated for isolation and testing. I mean, chances are they have also contracted this illness, right? So the senior clinical officer, who has worked for about 25 years, had not been supplied with protective clothing. See, that's a problem. His infections raises fear among thousands of Kenyan clinical officers and nurses who were first contacts with patients in health facilities. Now, different groups representing health workers now say they are exposed to the virus in their daily work, and it is possible hundreds of them and their families will become victims of the virus. And so, just quoting the Secretary General of the Kenyan Union of Clinical Officers there, Mr. George Kibore, this is what he said. And he said, the clinical officer has been performing her duties in the outpatient, and you can understand the anguish she is going through knowing she may have infected her family. Are you just worried about her family? How many Kenyans that she came into contact with that possibly she has infected? It's not even whether she did or not. The chances are 100%. At least she has affected somebody in her line of duty. She works at the outpatient, so there are probable chances that a number of people, maybe one person, maybe who knows, but at least somebody has been infected outside of her family. Now we learn that even her husband has been infected by this. So it tells you that even our health workers now stand at a greater risk of contracting and also of spreading this COVID-19. And what I don't understand is why our health officials are not yet given the protective clothing that they require for them to carry out their duties. And that is what I think the nurses and the doctors in Zimbabwe, yesterday they went on a strike, and the other day they said, as much as Strive Masiwa has come out and said he shall pay for us the money that we require because they wanted to go on a strike. There has been a lot of problems in Zimbabwe, but the other day they still went on a strike and they said until we're given the PPE PPEs, the protective clothing and equipments that they require for them to carry out their duties in these very difficult times, then they're not going to go to work. And now, from what I'm reading this morning, you know, their fears are very founded, because they are actually very much exposed a lot. Because when somebody comes to the clinic, you're taking their temperatures, you're talking to them, you're taking their you're taking the all of that, all the vitals and seeing and all that before they move to the doctor and all that. You are the first contact. So it's very, very vital. And right now, I think all the health workers require to be absolutely protected and to make sure that they are safe. So change of guard, a new dawn at Safaricom as Peter Ndegwa takes charge. That story is on page 6 of the Star newspaper. Also on the front pages of the Star newspaper, there, outspoken Justice Priest Ndingi Mwananzeki, who died at the age of 88. I would have imagined that he was perhaps older than 88, because the last time I checked, even when he retired, he seemed very old. And growing up, it was a name that was synonymous with a lot of moral authority as far as church was concerned here in Kenya. So he retired in 2007. They are now the outspoken Justice Priest of the Catholic Church in Kenya, His Grace Raphael Ndingi Mwananzeki, rested yesterday. The retired Archbishop died after a long illness with reports indicating that the 88-year-old was pronounced dead on arrival at Marta Hospital yesterday morning. And His Eminence John Cardinal Jue has announced the passing on of Nzeki and prayed for the repose of his soul. I read a statement from the Archbishop of Nairobi, the former Archbishop of Nairobi, who was unhesitant to speak truth to power, often put the Catholic Church on the spot when he often clashed with policies of former President Daniel Arap Moi, and then kind of strongman and a very authoritarian ruler. His strictly biblical approach to church, government and everyday life endeared him to Kenyans to the extent that many refer to him as a human rights crusader there. And so his contribution to this country, especially during the very difficult times of multi-party democracy fights and when human rights abuses in this country was just on another level, I think will be greatly appreciated. And his contribution to this country will go down in the books of history in Kenya, and we still continue to say, as the Punchline Africa family, may the soul of former Archbishop Ndingi Mwananzeki continue resting in peace. And according to the Ministry of Health here, there are 59 infected government people and government is well prepared to the site. So the government here is telling us, as much as these numbers they're projected, as much as there's a surge that is expected because of how now this virus is being spread from one person to the other. And very clearly we can see now you don't have to worry about any imported cases anymore. And even the Ministry of Health through the CS the other day told us that now this is a homebound thing. It is moving from one person to the next, and that is where now we might see an upsurge of a lot of people contracting this illness. So therefore, what to do when you get home? These are just some of the tips that are the Star newspaper, and I must really commend our media houses. They have been on it. I watch other international media houses, and you just get the information, and you get the numbers, and you all these things that are happening across the world. But in the Kenyan media here, I think this time they have outdid themselves, and they are in the forefront to make sure that Kenyans really understand what's really going on, and Kenyans get to know and get the information that they require to ensure that they're able to keep themselves safe. As a media, I think all of our media houses have taken upon themselves to have these campaigns and initiatives to just create awareness around what you should do, what if you suspect you have coronavirus, what are some of the symptoms, what should you look out for. And very interesting, I was just going through some information early in the morning, according to some researchers there in the UK, very interesting. So it apparently, if you feel that you have a problem and you've lost your sense of taste, it could be a symptom that actually you have the COVID-19. So these are just some of the things that perhaps you should look out for. If you didn't know, then now you know. But we shall look at that and what also companies like Lamborghini in Italy are doing. And now they've changed from building the cars. Right now they've halted, and now I'll let you know what else the Lamborghini company is doing there to help fight coronavirus. You know, Italy is one of the countries, the leading countries, the leading country in the world that has recorded the highest number of deaths right now. I think stands at over 12,000. Very sad figures there, and indeed very sad. We've seen an upsurge in the United States. We've seen an upsurge across those other in the Western world. In Africa, we've seen an increase in numbers, but the death rate is still not as much, and so we are grateful for that. And I'm just praying, crossing my fingers. Then, as much as we are seeing the increase in numbers, which is expected because of the contact, these people had come in contact with other people, and so the chain continues. But even as the numbers continue to go up, and that is expected, I'm just hoping that the death toll will not be as much. So that is where we are. Kenya, we have recorded 1 death so far, and right now we have 59 people who have, have this COVID-19. And so we go to our last newspaper here, that is the Standard newspaper. Remember, Dr. Matanga had gone through these papers early in the morning. He had a show earlier, that is the Daytime Express, about you should be tuned in. He said he'll be on starting every day at 9 a.m. to 10 East African time. So if you are an early person and perhaps later on in the day you might get busy, but you still want to get your dose of what's happening across Africa, then you better be tuning into this show, because Doctor there has so much in store for you. He shall be joining me on the top of the hour so that we get on to look at the topic of the day and also other news making headlines across Africa and indeed across the world, because now we've become a very small village which seems to be suffering from the same thing. And so at times like this, that's when you realize, man, we need each other. I was just reading some news before I came here that really shocked me. Russia is now sending some help to the United States, which I think President Donald Trump will really appreciate that, and that will he will take the opportunity to say, see, Russia is not that bad. I mean, Putin, he has a soul. He's helping us, so you need to cut him some slack. You all who have been saying that, Russia is the biggest enemy of the United States, I'm sure Donald Trump will not miss an opportunity there to really pull on some sideshow, because as I read there earlier, I think on the BBC or CNN site, just a few minutes before I came here, Russia is sending some help to the United States, and so of course help there is much needed, even as the numbers continue surging. The United States is leading with the number of infections, but Italy so far is leading with the number of deaths, so it's still not good. All right, I saw the front pages of the Standard newspaper. Of course, a bishop who fought for Kenyans transition, tributes pour in for Catholic bishop who stood up to government and demanded political and economic freedoms. And Ndingi retired in 2007 and died yesterday. So the story is on page 2, 3, 4, 5, 6, 7, and 8. Oh, that's all right, that is very befitting. So if you really want to know more about this Archbishop, former Catholic bishop, just go to the Standard newspaper, and they've carried out a lot about the life and times of Ndingi Mwananzeki. Ndingi helped the needy quench their thirst for education. And so and on page 4, just a bit of it, the Most Reverend Raphael Ndingi Mwananzeki, Archbishop Emeritus of Nairobi, will forever remain in the minds and hearts of many Kenyans for his fearlessness in calling out the political class to account for their misdeeds. Outspoken and a household name, many will remember him for fighting injustices, especially in the lead-up to the introduction of multi-democracy in the country. That is when the church had not lost its moral compass, all right? Now, our pulpits have become a joke sometimes, where politicians take a lot of their nonsense there. But those days when Ndingi was the Archbishop of the Catholic Church, the church still had its moral compass. So the cleric who celebrated his 50th episcopal anniversary in August 2019 is famous for standing up against the Kanu regime during the 1980s and early 1990s when he was Bishop of Nakuru. And in 1992, for instance, Archbishop Ndingi showed his fearlessness by openly standing with the victims of tribal clashes in the Rift Valley and laying the blame on the Kanu government. He did not mince his words, and that is sometimes what you need, a fearlessness and some boldness if you really need change to come. And so, as I said there earlier, his contribution will forever go down in the history books of this very great country. And still on the front pages there of the Standard newspaper, coronavirus cases hit 59 and Nairobi tops the list. Now 9 more people confirmed positive after 234 tested in 2 days as government monitors 1,160 others who had contact with the patients. So 9 more people, and after 234 people were tested for 2 days who were suspected to have had this virus, and only 9. So that is such a relief. Out of 234, only 9. And so right now, as I said there, Kenya, we only have recorded 1 death, and this person died. He had pre-existing conditions, so perhaps he was not in his best of health even at that time when he contracted the coronavirus, and so he passed on last week. And so that is the only death that we have confirmed. But so far, we have 59 people, and of course the numbers keep increasing. Last week we were at 30, and now we see we've gone up, and of course Nairobi is still leading with in terms of the cases of this. And so these are just some of the tributes from just reading on the front pages of the Standard newspaper, and then we shall just move on to other news. And President Uhuru Kenyatta eulogized and says, Mwananzeki, and he said, a Kenyan icon, a bastion of peace and a man of true faith who answered his lifelong calling as minister of the gospel and a shepherd of mankind. And Raila Odinga, the leader of opposition here in Kenya, and as President Uhuru Kenyatta like calling him his big brother. All right, this is what he said, that Kenyans knew they could always count on him to stand and speak in defense of truth and justice. Whatever the threat that posed to his life, he was one of the brightest lights to have graced our nation. And I'm sure Raila Odinga really appreciates, because those days as the government, Ndingi was standing firm in the face of the government that was sometimes very brutal to Kenyans. Mr. Raila Odinga was suffering his own tribulations being meted against him with the same government. So he understands that time, and perhaps more than anybody in this country appreciates that Ndingi stood up and spoke against some of these human rights abuses. And his sense of integrity made him totally uncompromising with the evil or those who mistreated the poor. A great son of our church, a great shepherd, and a great patriot. That is what Archbishop Anthony Muheria said. And Paul Mwite said, oh, Paul Mwite, look at him. The people who just disappear and then you see them every now and then. So Paul Mwite, lawyer, is one of them. And he said his contribution during the dark days of a republic was invaluable. He was a moral voice in the struggle for the second liberation. And this is what Reverend Timothy Njoya, who is also known for his boldness, this is what he said about the late Ndingi Mwananzeki. Ndingi was in the league of those chivalrous servants of God who carried their clothes with dignity, as opposed to present-day capitalist clerics who prefer carrying money bags. But true. And Koigi Wamwere, this is what he said. This is also another man, I think, who also appreciates that Ndingi spoke then, when Ndingi spoke, because also at that time he was going through also a very difficult time and the government was on his back. Moi was no joke. He led this country 24 years. So iron fist, especially after the attempted coup that happened in 1982, Moi became something else. So this is what Koigi Wamwere said. Since Ndingi retired, the church has lost its voice, yet it is expected to be the consensus of the society. He was among the most courageous people I know. It is terrible. We have lost him indeed. Ndingi Mwananzeki will be greatly missed. But as I said there earlier, his contribution that he's made and he made during his time in this country shall forever be remembered and appreciated, and he shall go down in the books of history in this country as a person who really stood and spoke out when it was absolutely necessary, and the conditions were not even very favorable at that time. And so right now, that is just what is making headlines across the country. So just a couple of things that we're going to look at, some of the priorities, civil education, and some of the things that the government of Kenya is doing. We've seen volunteers coming out, we've seen some NGOs coming out, and people have been asking all these very philanthropic individuals, not just in Kenya but across the world, where are they? The contributions that they've been making, where are they? The rich people in this country, the millionaires in this country, the billionaires in this country, where are they? This is the time we need them to come to the table and tell us, all right, so this is how much, this is what I'm going to do, because they're always all over the place, trying to inspire people, trying to change lives. This is an actual time that they could actually make an impact by saving a couple of lives, right? And I'm sure Kenyans will appreciate. So even as that happens, we've seen a lot of organizations coming up. We've seen a lot of water points being set across Nairobi and other towns here, and we've also seen that replicated in other countries across Africa. I've been just looking at the information and the news that is coming in, and of course we shall be looking at the latest numbers here. But before we do that, just a bit of a global perspective. And right now, perhaps if you want to volunteer, some people don't even know how to volunteer. I saw in the UK and also in the US, there are health workers who have not come out of the hospital for a very long time, and they work for long hours. And so we've seen, I was watching another news piece in the UK where a few individuals have taken upon themselves, they make food and they take to hospitals to ensure, even as these health workers, the nurses, the doctors, and everybody else is trying to save lives and take care of these patients, because right now hospitals are really overwhelmed. Africa, we are lucky. We don't have that yet, and I pray to God we don't get to that level. And those cases I see when you watch these international media houses, but we've seen them rally together, and they're out there and they're saying, how can I help? How can I make it easier for you? How can I lighten the work we have? So what I'm going to do, I'll just together with a few of their friends, they come together, they make the food, they take to them, they take turns to ensure, even as they take care of the sick and they save lives over there, they also continue to be replenished. They're not, they don't go out of food, because right now they don't even have time to leave work, go home, go to the grocery stores, get something, and then, it's very hectic for them. So I've seen a couple of volunteers come out, and also in Kenya here, a couple of days ago, I saw an individual who started an initiative. I don't know how far that has gone, and they're trying to just collect some food stuff, dry food stuff, so that it can be given to the people who, especially from the slums here in Nairobi. We have the biggest slum over here, and so a lot of people, a huge population in Kenya. Should the President Uhuru Kenyatta, and we were having this conversation earlier with somebody who called me early in the morning and said, I don't understand why President Uhuru Kenyatta has not announced a lockdown. This country, it deserves to be on a lockdown right now. I said, you know what? It's very nice, and I'm sure President Uhuru Kenyatta has thought about it and perhaps considered, but there are other factors that cannot be ignored. A huge majority of the people in this country, a huge number of people here live from hand to mouth. I told the person, me and you can afford to stock up for a week or two. We can afford to go buy some rice, some maize flour, some wheat flour, just put in the house there, and then we eat, and a week or two we shall be fine, right? But that is just a few of us who are at this point perhaps fortunate that we can do that. But the majority in this country, the majority in Africa, we cannot do that. The governments cannot afford to do that, because even right now, President Museveni, as much as it is a lockdown, he has only not only the cars are not moving, but human beings, if you can walk from here to wherever you want to go get your food stuff, you go. But you're not going to use public transport, and you're not going to use a car, because even there, as much as that move by President Museveni has been well criticized, and it came very abruptly, and that is because the measures that had been put in place earlier on are not being adhered to. So he said, okay, you know what, I said this number of people should be carried in the public vehicles. I said these public vehicles should also be banned, and if you have to use a personal vehicle, then you should carry a certain number of people, and people should stop overcrowding in places like the city, the capital there in Kampala, and people are not listening. So he said, you know what, so no vehicles. So right now, no vehicles in Kampala. But if you can walk to go wherever you're going, as long as you're not in a crowd exceeding 5 people, then that's fine. You walk, go buy whatever you want to buy, but keep social distancing. So that is the reality that a lot of African countries have to grapple with. A lockdown sounds very nice if you live in the UK. A lockdown sounds very nice if you live in Germany or in Netherlands or which other country there. We're seeing they're now enjoying spring, and they're not even worried very much. A country there in Europe sounds very nice because the systems there work very well, and they will identify people who perhaps may not be able to stock up. They'll identify people who need help, and actually the governments are able to help them. Now, bring back the situation here in Kenya. So this morning I was telling this person, me and you and a couple of others, very few percent can afford even to stock up for a week. But there are Kenyans who go out and will work, and when they're given that 200 shillings, that's when they go plan and they go. So they live literally from hand to mouth. And now, because the industries have been affected, not just here but across the globe. If it's an industry that deals with certain things, perhaps they get their raw materials from China or somewhere else, which right now there's nothing that is happening. There's no new shipments coming in, so people are affected. So at the end, some of these small-scale industries of especially non-essential goods industries, they've been forced to close down for now. For now, even the hospitality industry, they have been forced to close down for now. I have a person who I know, he came and he said, you know what, I'm going to the village. My job is over. I cannot afford to stay here anymore because the last pay I got, I've only been given the pay for March. So they've left the city, they've gone home. So if things come back well and the COVID-19 goes away and everything bounces back to normal, the person will come back. And so this has affected so many people. So now if you want to go, say the country will go on a lockdown, and that is the hugest, the biggest challenge I think even President Uhuru Kenyatta and his government are grappling with right now. But if it was something that was possible anywhere in Africa, let me tell you, we would all be on a very wonderful lockdown. We'll be given 2 days to go stock up, and then the government will be like, from now to the next 14 days or 21 days, no movement, so that we're able to curb. So as much as, and that is why it's very important to listen to some of these things that the government is putting in place to ensure that me and you, we are safe. But unfortunately, we see a lot of Kenyans, we see a lot of African countries, we're not following this. So now it is forcing our governments to pour army on the streets, to pour the police, to keep you inside your homes. It is for your own good. I don't know why people don't understand this. So now as we speak, the latest global numbers are up more than 860,000 confirmed cases, over 860,000 cases right now as we speak. The numbers have gone up, and also cases, and more than 42 deaths have been reported since an hour ago. And also the latest, just from the UK, the government is facing growing criticism over a lack of testing for frontline NHS staff. Health workers who are self-isolating have expressed frustration because tests are not available to show whether they are clear of the virus. So I was just watching a news item this morning. So it's like it's like the HIV test kit. I don't know that, or it looks like the HIV test kit or the pregnancy test kit. You know the way it is. So apparently, if it shows 2 lines, then I think you're positive. It is, if it's just one line, then you're not. More like the pregnancy, test kit. So that is what is happening. But also we've had cases of some of these test kits that are faulty, and of course right now they're all coming from China. So somebody here was yesterday, as we were having the shows, like, oh, how is it just a coincidence that China now is supplying the rest of the world with the mask? China right now is supplying the rest of the world with these test kits. So and then this disease emanated from China. So people really are trying to understand and to, have all these theories of what could be happening and why China is now coming back to normal, while the rest of us, we are just trying to make sure that we are safe. And also still in the UK, a 13-year-old boy is thought to be the youngest person to die with the disease in the UK. And also in Scotland, MPs are set to push through emergency powers to tackle the crisis. And meanwhile, some of the UK's biggest banks have agreed to scrap dividend payments and hold on to the cash which may be needed during the corona crisis. That is, I think, a very good move there. And new research suggests that a loss of smell or taste may be a sign that you have coronavirus. Now listen, I heard about this and I said, this is not good, because if you have even the slightest of flu, you lose your taste. And that's when you'll hear a lot of people say, I don't have an appetite. So they're saying, if at all you're sitting there and you're eating food and you cannot really appreciate what it tastes like, the nice ingredients that have been used to prepare that food, you cannot really tell them apart, and you've lost your sense of smell, then this is what they say. New research from the UK suggests that losing your sense of smell and taste, all right, like I have to really check if I'm smelling right, because this is worrying, and it could be a good way to tell whether you are infected. Now, King's College London says its scientists have asked people to log their symptoms daily in an app. The results showed that 59% of the 1.5 million people who participated and tested positive noticed a loss of smell and taste. According to the researchers, this makes it very a good indicator for spotting infection. So look here, if lately, in the couple of days or the couple of few hours, you have been having trouble with telling apart smells, you don't know which perfume, you can't even tell because your sense of smell has been affected and your sense of taste, then look here, that is an indication that perhaps there is a possibility, because these are symptoms that usually comes when you have a flu. You'll have a problem with your sense of smell and your sense of taste because of how those glands are connected at the back of your mouth there, and the eyes and the nose and the mouth at the back there, and that is where the virus goes and attaches itself and starts to multiply, because the virus cannot exist outside of the body. It requires a host body so that it's able to multiply and survive. So apparently this virus goes behind there and attaches itself there and starts to multiply. So if you have experienced anything of the sort, what they're saying is there is a 59% chance that you could have the COVID-19, but that should not be a source for alarm. If you see that you're probably having these symptoms, I think the best thing would be to go seek, of course, some medical attention. And under the current UK government guidance, people are advised to self-isolate if they have a new continuous cough or fever. The World Health Organization says other symptoms can include shortness of breath, aches and pains, or a sore throat. Aches, like headache or joint ache, or what kind of aches? I think they should be very specific to these aches and pain. What kind of pains? Chest pains, head, what? I think, yeah, but if you experience any of these, please run quickly to the next healthcare. And when you go there, make sure the healthcare provider there is protected, because now we see they are on the front lines and they've been handling a lot of these cases. So others are infected and they don't know, so make sure you're safe. And in New Zealand, it's been almost a week since New Zealand, a country of 5 million people, plunged into a full lockdown. So New Zealand, as we speak, is on a full lockdown. So case numbers remain relatively low at just about 700, and but testing has increased. So the new case rate also slowed in the past week, but Prime Minister Jacinda Arden has warned that there's still weeks of lockdown to go. So cases in New Zealand only 700, but they went on a lockdown almost immediately, and so the country has not, they've not recorded so much of new infections. There are no deaths have been no death toll has been recorded from New Zealand. Of course, right now as we speak, the death toll in the United States has surpassed 4,000, and officials predict that as many as 200,000 people could die in the country. Now the U.S. President Donald Trump warns of very painful weeks ahead. This is a person who was ready to open the U.S. back to business during Easter time, and he said this will be a beautiful time for the country to bounce back. And they told him, no, this is not a political gimmick. These are people's lives here in danger. So you need to. So it's not possible. So right now he's just coming into terms with the reality of the impact that COVID-19 and the potential lives that could be lost there in the United States and in India. Cases in India continue to rise as the country is racing to build low-cost ventilators to prepare for the widening outbreak. Currently, there are around 1,400 cases and 1,123 deaths. And of course, in Netherlands, the Netherlands has extended its closure of schools, restaurants, the bars for about another month as the numbers of positive cases and deaths continue to rise. And of course, Dutch Prime Minister Mark Rutte announced that the extension would be until 28th April at least. And in Italy, of course, Italian supercar maker Lamborghini has started making surgical masks and protective medical shields, which it will donate to a local hospital. Now, the car maker said it will make 1,000 masks a day in its upholstery department, which will be delivered to hospitals staff in Bologna, northern Italy, which is one of the worst affected areas from the coronavirus pandemic. Now, Lamborghini also making 200 protective medical shields with use of 3D printers. These shields are primarily worn by hospital staff and healthcare workers. So that is just looking at the world in a glance. So right now, I'll just look at the latest figures in Africa, and then we shall look at some situations here, even as we wait on top of the hour for Dr. Matanga to join us, and we look at the current situation and another topic of the day in a different show there. And so as we speak right now, we start with the statistics, and of course Kenya, as we said there earlier, 9 more cases were reported yesterday, and so far the total number of cases in Kenya stands at 59 people dead. 59 people confirmed cases and 1 person dead, and 1 person has recovered. In Uganda, 44 cases have been confirmed. In Tanzania, 19 cases have been confirmed and 1 person dead, and 1 person also has recovered. In South Africa, confirmed cases is at 1,353, 5 people dead, and 31 have recovered. In Burundi, confirmed cases is at 2. In Zimbabwe, confirmed cases is at 8 and 1 person is dead. And Angola, confirmed cases is at 7 and 2 people dead. In Sudan, confirmed cases is also at 7 and 1 person has recovered and 2 people have died. And in Egypt, confirmed cases is at 617, 36 people have died, and 24 have recovered. That is in Morocco. That is in Morocco, where 600 confirmed and 17 confirmed cases. But in Egypt, the confirmed cases is at 710. 46 people have died and 157 have recovered. In Burkina Faso, confirmed cases is at 261. 14 people have died and 32 have recovered. In Somalia, confirmed cases stands at 5. Yesterday there were 3, so now there are 5. I don't know who's testing. I don't know how the testing is happening there in Somalia, because also they have other insecurity problems to deal with. So the confirmed cases there, and there on your screen we see some figures from the African Union. And so in Cameroon, confirmed cases is at 193, 6 people have died and 5 recovered. And yesterday, while we were having our evening show, one of our viewers there was even saying that the dead President Paul Biya could be among them. Come on now, guys. There's something he said there, so it proves Biya is still alive, all right? And we shall look at some African news there on top of the hour just before I finish. And in Ivory Ivory Coast, 176 people and 79 people have died, have confirmed the cases. Those are the confirmed cases, have contracted the coronavirus. One person has died and 7 recovered. In Ghana, confirmed cases is at 161. 5 people have died and 31 have recovered. In Mauritius, confirmed cases is at 143. 5 are dead. And in Nigeria, confirmed cases is at 135. 2 people have died and 8 have recovered. In the Democratic Republic of Congo, confirmed cases stands at 98. 8 people have died and 2 have recovered. And in Rwanda, confirmed cases is at 75. Rwanda yesterday was at 70, even yesterday in the evenings. Right now it at 75. Rwanda and the DRC are really going up really fast, and it's worrying there. And also Madagascar confirmed cases is at 57. Zambia confirmed cases is at 36. Togo confirmed cases is at 34. 1 person has died and 10 have recovered. And in Mali, confirmed cases is at 28. 2 people have died. And Niger, confirmed cases is at 34. 3 people have died. And in Ethiopia, confirmed cases is at 26 and 2 people have recovered. So the Africa statistics as of about 2 hours ago right now confirms that Africa has 5,556 confirmed cases so far, and the death toll in Africa is at 221, which I think so far is low compared to these other deaths that are being reported across the world. But I'm just saying it is increasing by the day, and so we have a reason to start getting worried if you've not been worried yet. But of course this should help us take the precautions that we are supposed to be taking in terms of ensuring that we don't have any more infections, and we stay safe. And if you're sick, go and get the earliest medical attention. And of course, recoveries in Africa so far stands at 387. The global statistics, which I know by right now perhaps have changed. I think I read there earlier, and I think by the end of today, we will be at around 900,000. And by the end of tomorrow, I think confirmed cases across the globe will be at 1 million or so. So confirmed cases today alone is at 515. Dead people right now stands at 42,000. Over 42,000, which still represents about 4.9%, which is relatively low compared to the number of confirmed cases. And the death toll today has 11 people have died, and the people who have recovered so far is 178 and 100, which represents about 20.75% of the total confirmed cases globally. The US there is really going to hit another milestone there. I think they're rushing towards the 200,000 mark of confirmed cases right now. They're slightly over. They're over 188,578, and that was about 2 hours ago. So I'm sure the numbers perhaps right now have changed. The number of people who have died there is nearing 4,000, as I said there, and recovered is 7,251. And in Italy, which comes second in the number of people, the confirmed cases there is at 105, 795. The people who are dead there are about 12,424, and recovered cases is at 15,729. China has seen lately they've been having new infections, and right now the cases there are at 81,518 confirmed cases. But also I was seeing something that they're saying they shall bring out some some numbers that they had. They are not given out so that they're able to have the total number of confirmed cases. China has a way of just how they do their things. How is it that you did not include some of these figures? So now they're saying they will include some figures so we can see perhaps the number of confirmed cases in China might go up, but the deaths that have been reported there is at 3,305, and recovered cases is at 76,000. Confirmed cases in Germany is at 71,000. 1,808. 775 people have died and 16,100 have recovered. And the UK confirmed cases there is 25,150. Death toll stands at 1,789 and 135 have recovered. So that is just the latest in terms of figures that we prepared a couple of hours ago, and that figure, as I said there earlier, is subject to change, because I know right now there's a possibility that other figures have added in terms of the confirmed cases or the number of deaths or the number of people who have recovered. This has been the Good Morning Show. I'm going to take a short break, and then we shall come back at on top of the hour with our afternoon show, and we shall be, let me just confirm to you what we shall be looking at in the afternoon. And of course, in the afternoon, that is my opinion, and we shall be looking at our mindsets and the reactiveness. Are we to blame for tough? Our mindsets and reactiveness are to blame for tough restrictions. I don't know what is your opinion on that, but see you on the other side of my opinion. My name is Miriam Ogutu. I think it's the top of the hour here in Nairobi. A very good afternoon.